have long-term care, some type of long-term care. Okay? Good for you. I'm always going to encourage you, do not let somebody talk you out of your long-term care policy. I would also tell you that for years and years and years, we've said after the age of 65, don't price long-term care anymore because it's not affordable. We're all living so much longer today that we're now saying that up till 70, it's still cost effective. After 70, it probably isn't going to work from a cost effective standpoint. So for those of you that don't have long-term care, what's the major reason we don't buy long-term care?
Too expensive.
Stuff's expensive, Diane. Yeah, absolutely. What happens if we fund a long-term care policy for 20 years and never use it? Certainly they're going to give us a refund, right? No, that doesn't the way it works. And many of you saw your parents go into a nursing home and there's no harm, no foul. Medicaid just stepped in and paid the bill. There's some changes. Most nice long-term care facilities will not accept Medicaid anymore. So you must prove that you have a long-term care policy or you have assets to pay for 3 years of long-term care, in that the average stay is 2.7 years. So if that's kind of past you, there's some other products out there that have what's called long-term care riders. Life insurance policies with long-term care riders, and a lot of annuities have long-term care riders. Popular example on an annuity long-term care rider. You put $100,000 in. It grows, but not by much, a couple percent every year. But if you go into a nursing home, it will pay you 3 times what you invested. So it's going to pay out $300,000. Let's say Diane never goes into a home. What happens to her $100,000 upon her demise? It just goes to the beneficiaries. So you never lose it, but now you kind of set aside some money to help fund that long-term care plan. Because when we think about long-term or nursing homes, we probably don't want to cover the whole cost. I mean, that's almost cost prohibitive, but we certainly don't want to give all of our assets to a nursing home as opposed to passing them down to our beneficiaries, if that makes sense to you.